We're live.
Okay, today's going to be on what is our life care plan, and our speaker today is Maureen Raffa, and she's from the law offices of Stephen Sotera, and I know that she has a really nice long title, and she can introduce you and tell you what her nice long title is. Oh yeah, there we go, Elder Care Coordinator. Doesn't it sounds good, doesn't it? But anyway, I hope you get as much out of this week as you did last week, or even more. Okay,
all right.
Turn it right over to you, Maureen.
Thank you very much.
Sure.
So just so you realize, I'm a nurse for just about 45 years, so I've had a lot of different experiences between inpatient and home health and hospice. I taught nursing students and nurses' aides, and worked briefly in a nursing home years ago, and I was in managed care. I know the evil HMO.
Yeah.
but a lot of knowledge because of that position at good old Blue Cross Blue Shield. Then I actually retired from Blue Cross, and I worked marketing the inpatient senior behavioral health unit at Metro South till it closed. So I was there and helped a lot on the unit. And then, so I've been with Steve now almost 2.5 years. He actually is an elder care attorney. So he specializes strictly in estate planning and trust. He doesn't do piecemeal. You can't go to him for just anything. So it's basically for estate planning. And he belongs to this Life Care Planning Law Firm Association. There's about 100 across the country. And so I'm also on the board of Pathlights, your speaker from last week. So is Steve. And so I happened to mention at a board meeting that Metro was closing, but I was still looking to work. So he sent me the job description, and I'm like, well, it's me. So here I am. But it's a culmination of, life experience and all my nursing experience that really makes me, it's a good fit. It's a good fit to help people. So that's enough about me. So, you're going to learn and understand what a life care plan is, how it differs from traditional elder law, the good reasons to have a plan. If you're not already aware, the increasing cost in aging, find out the best time to develop a plan, and really what all an elder care coordinator can provide for people. So what the heck is a life care plan? Well, it's actually a plan to help aging adults find, get, and pay for the care that they need now or in the future. It's a very holistic, elder-centered approach that helps families respond to every challenge caused by chronic illness or disability of an elderly loved one. And the goal, of course, is to promote and maintain good health, safety, well-being, and quality of life of elders and their families. So it's actually a relationship and a planning process. And the plan can provide a roadmap that allows the client to follow through to achieve their quality of life and long-term goals. So it's really kind of the intersection of legal and healthcare planning. Traditional elder law focuses pretty much on your estate planning right, your will, how you're passing down whatever, you have to give to your younger generations, certainly financial decisions, but this kind of helps bring everything together because so many people do have healthcare issues that they need some help coordinating services. So Sotera Law, and also I include AZ Health and Elder Law because I actually moonlight with another elder care attorney, and so I have a client with her right now. So the whole Life Care Planning Law Firm Association was established in 2007, and as I said, it's kind of evolved because of the complexity of healthcare system and payer sources that can be so confusing to people. And I had mentioned that there's about 100 law firms across the country. There's 4 in Illinois that I'm aware of, and 1 in it's northwest Indiana. In addition to helping with the retirement and estate planning, they do have somebody, usually a social worker or an RN, although I am aware that former teacher, former nursing home administrator, so there's other people that are qualified to also provide this kind of guidance. So it's kind of like being the quarterback calling the shots for people. Okay. So of course the heart of the elder-centered law practice is the life care plan, which defines, organizes, prioritizes, and mobilizes every aspect of an elder's care. So it's a customized roadmap for life. And so in addition to the traditional asset-focused, and the estate planning, it's provisions for care coordination, family education, healthcare and financial decision-making, care advocacy. My whole career as a nurse, I always advocate for my patient or client. And I can be a little bulldog because it's needed. Yes. Crisis intervention and support and other services that might come up. And it's a little bit different from care managers. A lot of you have probably heard of care managers. Wonderful people also, a lot of social workers, a lot of nurses. But care management companies also do more of the hands-on, where I'm the coordinator, the navigator, so I'm not actually doing the hands-on. I'm not going to be filling your meds for the week, and I can't transport. Working for an attorney, I can help coordinate transport to appointments or whatever, and I can meet them there, or I can ride in the Medicar with them, but I can't drive them. Liability, right? That's what working for an attorney does. So life care plan objectives, again, is to make sure that the elder gets the appropriate care, whether at home or in a residential facility, so they can maintain the quality of life that they desire. I help locate any public and private sources to help pay for the long-term care while resolving some of these issues, and it offers peace of mind to the client as well as their family when the right choices are made to ensure that they're safe and getting the right care, and also trying to preserve some of the family resources. Now, COVID certainly created challenges, right, for all of us, and in seeing people, but I never stopped seeing people in their home. We just masked up. I do have a client that's in a facility, and I still see her regularly every other week, but you know, they had set up an outdoor room. But it was still through a glass window. Makes it cumbersome, especially when somebody's hard of hearing. But we got through it, and now we're all back to being in person, live. So it's a lot easier. So aging, of course, is a process that is inevitable with the passage of time, and is a stage of life that brings its own challenges and rewards, just like any other stage of life. But successful aging is hopefully decreasing risk of disease and disability and increasing the level of mental and physical functioning. So people with illnesses, lost relationships, and other stressors, like a big move to downsizing, consider themselves successfully aging because they actually have developed good coping skills, and they can see the positive aspects still in their life and focus on them. Another good term for that is called being resilient. You kind of learn to bounce with the punches, right? So amidst the losses of age, though, are very precious lessons and graces, and to find these is actually to age successfully, whether you're in a wheelchair or on cross-country skis. Because, you know, we don't like to talk about aging in this country, right, or preparing for death and dying. Because most people think they're going to die in their sleep and hope that they're going to. The unfortunate statistic, though, folks, is that only 10% of us are that lucky. Most of us actually die inch by inch. It's a process.
I'll be the 10%.
I'll bet everybody in this room wants to raise their hand and be in that 10%. So, what are some keys to successful aging? Well, we all need a reason to get out of bed in the morning, right? We want a sense of worth still and purpose. So you need to think about what yours are. You know, what do you consider a good quality of life? Because life is a journey from the get-go till the end. So do you have a plan A? Do you have a plan B? And even a C? Because things don't always work out the way we would like, right? So what are your goals for this chapter? And do you have enough leisure activities that give you excitement and joy? Socialization. Socialization is so important, and I think it became so apparent with the COVID pandemic that the people that were kind of getting through it, and believe it or not, even though it was very hard and devastating for older people, not being able to see the grandkids, the people in the facilities, the reality is that population did better than the rest of the population. I think probably because they'd already had so much life experience to help them face it. But socialization, a sense of love and belonging is key. Is definitely key. And timing is everything with the life care plan. Of course, it's most effective when it's done early, but it's important to recognize signs of trouble. Caregiving is one of these things that most people can't really understand until they've done it themselves. How many in here have been a caregiver or are currently a caregiver? Yeah, I've done it too. So tough job, right? You're trying to still balance your own life and keep your sanity and fully taking care of somebody else. It's huge. So until you start being a caregiver, especially full time, or living caregiver for your spouse or your parents, you don't realize how really overwhelming it is. So the level of effort required isn't something that can be sustained by one person for years on end. You know, they need help. So people start reaching out because questions come up and they don't know how to answer, and they just can't continue doing it all on their own. So, and that's where, you know, if you can afford it, having an elder care coordinator or care manager if you don't get enough family support. How many in here are the primary caregiver where you don't get any help from the family? Yeah, happens way too often. Way too often. So often adult children are actually the driving force to get help for their parents. And unfortunately, too often it's that trigger event, either some kind of new diagnosis or an injury, that brings it to them. So if your elderly partner or mother or father keeps forgetting where she puts her keys, or if she keeps repeating herself because she doesn't realize she's already told you 5 times, it is time to be concerned. And it could be, you know, there is some age-induced memory loss, but it could also be early signs of dementia. So the key is, how frequent is this happening, and the extent of the forgetfulness, and also the bigger key is if they can't retrace their steps. Like a lot of us misplace things, right? But we retrace our steps and we find it. But with dementia, they lose that ability to retrace those steps. And then frailty. We just get weaker, our muscles aren't as good, especially if we're not as physically active as we once were. So many older adults find it difficult to do everything they once did without help. I mean, I just sold my house, but I couldn't clean my house as quickly as I did 20 years ago, you know, so it just happens to all of us. So if you observe your loved one becoming more frail, then you need to start thinking ahead, and what's your action plan if they can't care for themselves. And all too often we wait till the crisis occurs. But I discovered this years ago when I worked home health hospice, and it was mostly seniors that I was visiting in the home. They couldn't handle more than like one thing in a day, like one appointment or one visitor. It gets too overwhelming. And this is people that don't necessarily even have dementia. This is just kind of part of normal aging. I know my sister already is like that. She's 3 years older than me, yeah. One thing a day. Or a medical event, okay? We never know if we're gonna have the stroke or the heart attack, or we get diagnosed with some kind of chronic illness like Parkinson's or congestive heart failure, Alzheimer's disease, or any of the other dementias. But the important thing with all of these is that they often very much impact our independence, right? So, crisis situations, it could be an accident, it could be a fall. I mean, you know, most falls actually occur in the home, right? We all know that. Slips and falls on those throw rugs that are dangerous, or in the bathtub, and then we hit our head when we fall. Or it could just be a medication mishap. A lot of people are on several different medications. Sometimes they interact with one another and cause dizziness. And then so many families actually come to us after something has happened. You know, mom's already fallen, she's broken her hip, now she's in rehab, but they're discharging her because the money's run out, right? Medicare, how many of you know that Medicare promises that you get 100 days, up to 100 days in rehab? How true is that really?
Oh.
You gotta meet criteria to get those full 100 days. So the bulk of it is on day 21, you're out the door. And then you may need follow-up home health or outpatient rehab to continue, or you discover that they can't even go home, that they're gonna need to stay, but then it becomes custodial care. And guess who pays for that? You do, it's out of pocket. Medicare is health insurance, it is not long-term payment. How many of you in here have long-term care insurance? Yeah, not too many, and that's pretty standard. It's expensive, and if you don't buy it when you're younger, like say around age 50, when the premiums are lower, or before you've been diagnosed with a chronic illness, because you'll get denied if you already have a chronic illness. But it's a godsend for people that need in-home care or need to go to a facility. I have clients that just moved to Virginia to be near their daughter who lives there, and he was a business owner, and I still have to find out what his plan was because my daughter wants to know. She's at the right age to be buying it, and but they're both in assisted living, and his long-term care insurance is actually covering the cost of that assisted living. I know, amazing, amazing, but that's so rare because for the most part it's out of pocket. So good care is actually very costly, but inadequate care can be devastating. So what does aging look like for you? Because again, as I said, most people don't want to talk about it or plan for it. It's kind of taboo in our country. We don't want to think about it because it's like, it's almost like we're in reverse, like the 20-year-olds that think they're invincible and nothing's ever going to happen to them. So the seniors start thinking that way also. But you really do need to plan, because if you fail to plan, you're actually planning to fail. And the crisis ends up limiting your choices. So when you do things when you're still pretty healthy and have all of your cognition, you're actually doing a good thing for yourself as well as your children, if you have children and grandchildren. How many are fans of CBS Sunday Morning in here?
CBS Morning?
Love that show. Well, a few months ago they had a commentator on, and she and I've stolen her comment because I think it's great. What is the biggest cause of death? Birth. Because guess what? None of us gets out of it.
What's the most important thing? Dying.
The biggest cause of death.
The biggest cause of death.
Birth.
Birth.
But it's so true. So chronic care. Most people are simply unaware of their potential need for long-term care and their financial exposure to the cost. So research shows that most Americans still equate long-term care with nursing homes, and that many believe that Medicare pays for long-term care. No. When older people or their family members do seek out information or care, then they face a complex and often mind-boggling maze of publicly supported or private options, administered by a wide variety of providers operating under different, sometimes conflicting, but often duplicative rules and regulations. And don't forget, if you've been a hard-working person and have saved and have a good pension, you're not going to qualify for Medicaid. at least not for a really, really long time. Because, you know, it's different for a couple, you have a little bit more leeway, but for a single person, you're only allowed $2,000 in assets to qualify for Medicaid. So, yeah, so,
Including your house?
right, everything's, if a single person, you're only allowed $2,000.
And insurance policies.
Pardon?
And insurance policies.
Right, that long-term care if you've got, but if you, again, with long-term care, you still may not qualify then because that's gonna be paying for some of that care. Yeah, but
Let's go
most
move
people
to
don't
Europe.
realize
I think
that.
they have a better plan.
Yes, they do,
Yes,
actually.
they do.
Europe has a lot of good plans, and especially the Scandinavian countries. They look out for their elders. Japan too looks out for their
Germany,
elders.
Isn't that, I mean, there's a downside that, it's very, very expensive because they're under a different form of government.
Well,
They're more
I think a good chunk of your income, just like with us, goes to the taxes.
Yeah, yeah.
But we pay
It's gonna, in the long run,
our
help
share of
you.
taxes too.
Yeah.
But you know, the U.S., you know, is opposed to doing like a national health plan, or so it's not going to happen in our lifetime here. So the elder care continuum. Right now, you're healthy, no functional limits. Then you might move to needing a cane or the walker. You might have to be on the electric scooter, and then somebody's actually pushing you in the wheelchair, and then you die. And then if you stay in your home, again, you're independent, all good. Then you start needing some assistance. Maybe somebody comes in a couple of hours a day, a couple of days a week. Or you choose to move to a retirement community. And, you know, there's different retirement communities. CCRCs are the continuing care retirement communities. So they have it set up that it's independent, then they have assisted living, they have memory units, and then the long-term or the nursing home section where you need total care. And then you die. So cost of care, of course, is none other than maintaining your home, which can be expensive, right? The older that home gets, the more you're replacing and updating. And so then, you know, but the more care you need, the more it costs. Whether you're in your home and have live-in caregiver or you're in a facility. And for in the home, unless you have a long-term care insurance policy, Medicaid isn't going to pay for your in-home care. They'll pay in a facility, but they don't pay in the home. Now there's a few outliers if you're really, really poor, like with some, there's some public aid, but it's really limited availability. So there are some other public benefits and available resources. So are most of you in the Orland area here? So Pathlights is actually your senior services agency that can provide a lot of help and support for you, and at no cost. I think most of it's no cost. So getting to the potential cost of care. Someone turning 65 today has a 70% chance of needing some type of long-term care services in their remaining years. According to Health and Human Services, women need on average 3.7 years and men 2.2 years. But the average lifetime cost of formal long-term care is $172,000. And again, everything keeps going up, right? This isn't going to stay this way. And remember, most people use their highest amount of their Medicare dollars on their health care in the last 6 months of their life. So, do you have money to also have some leisure besides needing some care? And a lot of people want to leave something to their heirs, and it's a noble goal. But a lot can happen during the aging process. So because it's a gradual process where illness and disability happen, and you know the independence can wane a lot, and they can't care for themselves. So that's going to eat up a lot of that, what you might have wanted to leave for your heirs. But the one thing I always tell people, the seniors as well as the family, the adult children. It's your money, and this is what you saved for your rainy day, and this is now the rainy day. So, but unfortunately, you know, there's a lot of adult children that are upset about losing inheritance, right? Not unusual, a lot of family conflict. So, and can your home transition to safe senior living? You know, you might need to, you know, put in that walk-in shower, or you might need a ramp to get in and out of the house. You know, make sure you have the grab bars. Some people might have to widen doorways in order to maneuver in their home in a wheelchair. So there's lots of companies out there that do this kind of stuff. But again, it all costs money. So we're all living longer for the most part. In 1900, the average age was 47.3. By 2005, we got to 77.9. I think we'd actually reached 78 or 79, but COVID knocked off a year again. So, so of course, more resources are needed to last the lifespan. And for seniors, each year of increased life expectancy costs about $84,700.
Repeat that again.
For seniors, each year of an increased life expectancy costs about $84,700.
Wow.
Now again, it all depends on your needs, and you know, not everybody. Some people can get by with less, right, and still be okay and still be safe. So the number of people age 65 and over by age group. This graph showed from 1900 to 2000, and then the projection is from 2010 to 2050. So as you can see, the lives over 65 and over by 2050 is like 80 to 90 million. And this is our country, not the world. This is our country. And then the 85 and over by 2050, there's going to be 20 million. And that's from the U.S. Census Bureau. So we also have a difference in, over the years, right, in our culture in this country. A lot of people that never married, don't have any children. The birth rate has been down for many years, so we don't have the younger population, enough of them, to support the seniors, right? Like for Social Security and Medicare, there's not enough people putting in the pot. So that's why they keep saying we're going to run out of money. It's a very real thing that we can all be concerned about. And it does make a difference if you don't have children, which is why my kids don't have kids. They're not having kids, which is why they're going to start buying that long-term care insurance. So men are blue and women are the purple color. And as you can see, by 75 plus, the women are, there's twice as many women living, right, after age 75. And then, you know, like I said, and the divorce rate has been high for a long time. So it all makes a difference if you're truly alone. So what can an elder care coordinator do? I can assess the home for safety risks. I can explain whatever complex senior issues might be happening with you, devise short and long-term care plans, help with proper referrals to get you either the legal help or the medical help that you need, or whatever services into the home, or help you think and plan if you have the money and you choose to move or transition to senior housing, what's the best fit? Is it geography? Is it being close enough for the kids to visit? What can you afford? And believe me, these senior facilities, especially all the brand new ones that have popped up, and they're absolutely gorgeous, right? You're talking 10,000 plus a month. I mean, it's a lot of money. That's a lot of money. So coordinate medical appointments or help with transportation, help evaluate or hire, help you monitor in-home caregivers you might hire when you don't have the family, arrange for respite for the stressed out caregivers. That's usually the family caregivers. and just continue to assess the medical status and the impact that it's going to have for long-term needs. Now, one of the things, because of my background that I also help people with, I can do appeals, like insurance and Medicare appeals. That's what I'm doing with the attorney at AZ Law, because she knows my background at Blue Cross, so she gives me those cases to help people. So far, I'm on the third one. So far, the first two, we won. But I know the language to use. I know what, how you defend, why they should be paying for it. Also, just getting equipment in the home, again, DME. And then if there's any home improvements, again, we can assess for that. And because I network, just like Chris, your daughter does, with Continuity of Care and some of these other groups where it's all people that do all kinds of senior businesses. So I know what's out there and who's available, who you can trust to hire. So the other thing I do is encourage clients and families to have the conversation, and this isn't the one about the birds and the bees anymore. This is having that conversation about what your wishes are for how you're going to live until you die. So, you know, what do you understand about your disease? What are your fears and concerns about it? What's important to you? What do you want your medical care to look like moving forward? Are you ready to put your wishes and goals for care in writing so that you, your family, and your medical care team all know what your preferences are? So a living will is a great tool where you're putting it in writing. There's also a booklet called 5 Wishes, same idea. And then Compassion and Choices is another group that's out there, and they also focus, they have a nice detailed section on dementia as well. But so these things kind of get you thinking if you haven't already given it some thought. And you know, if you don't do those powers of attorney and if you don't have the living will, what happens? Chaos ensues, right? And if you haven't had the conversation, and then you have several children, but they're not all on the same page, so it's a lot of chaos, a lot of fighting and arguing, and your wishes aren't necessarily going to be honored. So then this is another helpful tool. It's called Go Wish. Some cards, but there's also a value assessment survey. It's 2 pages and it outlines different scenarios, and you answer what is and is not of value to you. It includes medical procedures, and you rank whether you want them just for a while and then you're going to stop, or you know you don't want it. And it includes things like CPR, cardiopulmonary resuscitation, chemotherapy, ventilator, right? This became really big during the pandemic, right? A lot of people all of a sudden jump-started and got their things. Also, pre-planning funerals. Pay now, because again, the cost is only going to go up. So again, with the other things I mentioned in the Go Wish cards, I can give you an example of things. You know, to know how my body will change, to be at peace with God, to be able to talk about what death means. I mean, it's just stuff to talk about. And then I have a poem. What happened to my poem? Here it is. It's called My Soul Has a Hat. This guy lived back in 1869 to 1929, but I would say he was a pretty smart fellow. I counted my years and realized that I have less time to live by than I have lived so far. I feel like a child who won a pack of candies. At first he ate them with pleasure, but when he realized that there was little left, he began to taste them intensely. I have no time for endless meetings where the statutes, rules, procedures, and internal regulations are discussed, knowing that nothing will be done. I no longer have the patience to stand absurd people who, despite their chronological age, have not grown up. My time is too short. I want the essence. My spirit is in a hurry. I do not have much candy in the package anymore. I want to live next to humans, very realistic people who know how to laugh at their mistakes and who are not inflated by their own triumphs, and who take responsibility for their actions. In this way, human dignity is defended, and we live in truth and honesty. It is the essentials that make life useful. I want to surround myself with people who know how to touch the hearts of those whom hard strokes of life have learned to grow with sweet touches of the soul. Yes, I'm in a hurry. I'm in a hurry to live with the intensity that only maturity can give. I do not intend to waste any of the remaining desserts. I'm sure they will be exquisite, much more than those eaten so far. So my goal is to reach the end satisfied and at peace with my loved ones and my conscience. We have 2 lives, and the second begins when you realize you only have one. Pretty deep, right?
Yeah.
So if you are planning for a year, sow rice. If you're planning for a decade, plant trees. But if you are planning for a lifetime, educate people. And this is really what elder care coordination is all about. It's educating people about what is available, that they have choices. People have the right to choose, to choose that end of life care. And it's your choice. It doesn't matter what your daughter says. It doesn't matter what your doctor says. You have the choice. So, and we plan for everything else, right? Births and graduations, showers, weddings, education, but not so much end of life and aging. And we need to culturally get that together and get on track, right? So, to summarize the value of a life care plan, the client gets the right care sooner, maximum independence, ability to age with dignity, and the families get help finding the right care and services, guidance with legal, health care, and long-term care decisions as their elder's condition progresses. And these were just some resources. The attorneys I work for, Caregiving Magazine, NAPC, it was another group I belonged to, National Aging in Place Council. A lot of good resources. There's a Chicagoland chapter. So, any questions, comments?
Could you back up that one?
Yeah.
Oh, sure. Sorry. The references?
Yes.
Sure. Yeah, so you can just go to naipc.org and they list members and the services that they can provide. Continuity of care, they have several chapters. There's a South Suburban one that would impact your folks, and so it runs the gamut of people that work in all these senior facilities, but also in home health care agencies. They're the companies that have the equipment that you might need in your home. Besides somebody like me, elder care coordinators, there's also there's, some of you may have heard of birth doulas that have been around a while. Well, now there's end-of-life doulas as well.
Really?
To kind of help support people.
Do they
Yeah.
birth doers?
Doulas. They're not necessarily a clinical person, but they do go through some training to help people in the birthing process, but now they have the end-of-life doulas as well. So I've actually met a few now in the groups that I'm in.
What's the
Doula, D-O-U-L-A.
what's the Orland group, Path something?
Oh, Pathlights?
Pathlights.
Past life.
Yeah, and they have a website, and they're on Facebook. And great organization.
Maureen, some people may not choose to ask, so I will, but I bet
Sure.
everybody wants to know, how much does it cost?
To hire somebody like me?
Exactly. See, I
Well-
see some heads going, yeah, that would be,
So-
what's the average, what are we
So
looking at?
just so you know, I didn't set the rate, because
No,
I'm still a nurse at heart. But because it's also kind of covers overhead and the other staff support, so, it's $165 an hour, but that doesn't mean it's always gonna be an hour. And we bill in 15-minute increments. And other care managers companies, I would say on average it probably is about $150 an hour. So unfortunately, not everybody can afford those services, right?
Right.
Yeah.
Another piece of information for
Right.
people to use.
Right. and I feel bad as a nurse about that. But believe me, I give a lot of free advice, you know, because that initial call, I don't charge for. And so, but then after that, I'm supposed to, you know, sign a retainer. But I've always worked, as a nurse, I've always worked for a company that just pays my salary, right?
Mm.
So now it's like
You have billing hours.
billing hours, yeah, just like the attorney.
Yeah, and the lawyer.
So yeah, but, and that's why I also do presentations, you know, like this, and get out in the community. It's just to educate again that there's gonna be needs if you haven't thought of it already, and things do cost, so if you can still manage to save some, so when you really need it, it's, but there's, and letting people know that there is help out there, you know, help people to get through it. Yes.
It's not really a question. I think the key word here was, you said it a lot, affordability.
Right.
Now, I've worked since I was 16 through 66, and there is no way I would be able to live a long time, my life out, if I was in a nursing facility at independent living at $10,000 a month. And how many women who probably work twice as hard as their counterpart male
And didn't make the
and
same
didn't make
salary.
half as much as their salary. And I'm reading a book right now, it's called Words of Life by Adam Hamilton. The average American has saved $25,000 for their retirement.
I know, it's really sad, and you know, part of the reason was, especially with the people even older than us, they thought Social Security was the end-all be-all. But as we know, Social Security is just a drop in the bucket. And so you do need to save and invest, but again, not everybody has enough when they've still just been paying their bills, right? And taking care of their kids and education, but yes, it is so true. People do not have the funds because they haven't saved throughout the years because they were living. And it's sad, and that's where the Europeans have a one-up on us, guys. I'm just saying.
But it comes at a price.
It does come at a
It
price.
comes at a price, and sometimes people are categorized and don't get the health care they need in time. That happened to my aunt in Germany.
Did it? Okay.
Yeah, and she had to wait 3 months for breast cancer to have anything done.
Oh, that's a shame.
Specialized
That's sad.
medicine, 'cause you can get different tiers. Some
Sure.
you can afford. So
Sure.
it sounds really good, but it's expensive.
I know, my son-in-law is actually from England, so of course he's pro their system. But I have to tell you, his nephew got hit by a car. He was airlifted, he had great treatment, he had great rehab, and we've never known.
But how much did they pay?
I don't know, cause I don't know like what they pay like each month out of their
Right.
paychecks and stuff, I don't know, but he did get terrific care. Yeah,
Pros and cons on
right,
everywhere in the country.
every,
I'll still live here.
right,
Um,
right, exactly.
I'm still living here, sorry, I'm still living here.
Yeah,
I am
so
too.
Are
I'm
there
not,
other
I'm not moving.
questions that you've thought about or need to ask?
what does the lawyer charge for?
His fee is $3.50 an hour, but it's different, like if you wanna go in for the estate plan, it's actually based on how complicated you make that estate plan and how many beneficiaries you have. So it's not like a one price fits all people.
Well, I'll tell you, I just went through my estate planning, and Art has a lot of forms that will help you figure that out, which you should look at before you go to the lawyer, so you're prepared, so that you're not gonna be there 4 hours, so he can charge you $300 and some odd an hour. A preparedness is good.
Right.
I don't have long-term care insurance.
Well, my
Because-
policy is minimal.
Well, the thing is, insurance companies,
Right.
they're in the business to make money.
Right.
They're in the business so that they don't have to pay your claims. So your best insurer is yourself. And you know, you say invest in the stock market or save your money. Banks aren't paying you. What are they paying you now? When we were kids, they paid more percentage than they do today
Oh,
with
yeah.
less money.
Right.
And you know, you can invest in the stock market, and that stock market can go up and down, up and
Well,
down.
it does.
What's the problem with this country is greed.
No, I don't
Greed
disagree
is the
with that.
problem with this country. Your nursing home facilities, they pay pittance to the people that are caring for you, but
Mhm.
they're millionaires.
Right,
Right.
the owners, right.
It's just like baseball, football,
Mhm.
whatever sport. You know, we've gotten so enamored with, oh God, they can hit a ball, they can hit a home run, or they can throw that football with, you know, and it's like, so what? Can they walk when they're our age?
No, they're in a lot of pain, and the football players have dementia
Right.
Mhm.
from all the
And they spend
concussions.
their money. There's a movie on Netflix right now, it's called Close Margin. And it talks about how Wall Street plummeted in 2008 because of the properties that they held, these REITs. And none of them went to jail.
No,
Enron, when they plummeted, and they didn't think they did anything wrong. Now, they didn't actually go and stab somebody or shoot somebody, but how many people did they kill because they lost their life savings
that's right.
investing in that company?
Right.
I think just, oh, it is now.
And it's just like,
Yeah.
it's just sad.
And as I look, but as you said, we started with 2 lives thinking about, and we're now down to 1, and how do we make the rest of what we do have
Yeah,
be good?
right. Fruitful
Now,
and
what
productive
point-
and,
You call Maureen.
What point would we
Yeah.
call her?
Yes,
Oh,
for assistance.
oh yeah, I have cards I
But
can
I
give
mean,
out.
at
if you want.
when,
Oh, after
Yeah,
you're
yeah,
your
mother,
now.
father's life? Right.
Right, well, if you're already dealing with an issue that you need some help with, you know, like as a caregiver, like for your partner or another family member
Yourself.
or just for yourself, if you want to kind of think about, like I had one, she was already a client of Steve's, and she just wanted to kind of find out more about it, you know, what exactly do I do and can I, and so it got her thinking though, to make sure she really did have everything kind of firmed up. I didn't have to stay with her, cause she pretty much had kind of taken care of things as it turns out on her own, and she was well set, but she was thinking in terms of, well, what if something happens to me and I no longer can care for myself? Do I want to go into a facility or am I going to stay at home? And so it got her thinking about what her next steps might have to be. And really what triggered it is she was helping care for a neighbor in her condo building who was 100 years old.
Mhm.
She tried to get the 100-year-old to hire me, but she was having none of it.
Just
So I think it's when you need some answers and before you get too overwhelmed.
Whelmed, right.
Well, like, I also have estate planning done.
Okay.
But it's, so, you come in at, if, like my dad is still, he's 94,
Okay.
so, and he's in a senior living, he's, but we're wondering, assisted, they have that level on the property too. He has estate planning already, so can you be called directly, you're not going through, necessarily.
Oh, you don't, right, I can be hired independent of the attorney. Like, if you've already got all your legal ducks in a row, you don't have to hire Steve. I can be hired independent. And you can just, this is the office number actually that's on my card. They put it, the way it works, they put it in the computer, but I'm checking every day, if there's any calls that have come in for me. We're all color coded. I'm yellow. So I know if somebody's called and I check every day, so I return calls pretty promptly and get involved. Again, it's just the work ethic I've always had, and you know, I will help you as much as I can, but you know, again, it's as much as people are allowing that help too. My services are really great, because this has happened now with several families, where the adult children are out of state, and so I'm that extra set of eyes and ears for them, checking up on mom. It's usually mom, it could be dad, but it's usually mom. And then I keep in contact, like after I do a visit, I always send an email to let them know how the visit went, what was going on. And like when I'm in a facility, like I see now that I'm in Orland, I'm going to see my client after this. So I have a relationship with the staff too, to get things, you know, to also help besides the sons that are out in California. And they come in now, it's a little easier, right, where they can come in for visits, but during all that COVID, you know, they weren't able to get in, but I was still doing my visits, and so I go when it's a facility, I go on different days at different times of the day, because you know you want to check out what's going on there, right? When nobody's watching,
Yeah.
and so they don't know you're coming.
Yeah.
So, and I would recommend that for any of you that have family in facilities. You have to have a presence, not a nuisance, because you know some of us can be a nuisance, but definitely a presence. Because the squeaky wheel does get the oil. It's just human nature. Yes?
Do you work with companies, like caregiving companies?
Well, I mean, I'm aware of them, yes. And so I know good ones that I recommend when
But
people
I mean,
want to.
as far as, like, I used to work for a caregiving company. I didn't do caregiving, but I did it for her child. But I wondered if she had somebody like you that she could recommend to her clients that she caregives. Do you ever do that?
Well, again, I know a lot of the caregiving groups out there, and so if somebody's looking for, you know, I always give 2 or 3, you know, so that I'm not showing total preference to anybody. I'm not getting any kickbacks or anything. But people that I know, I can trust, I would hire for myself if I needed it, or for a family member. So I do that, yes, I will give those referrals. Now, yes,
My husband currently is in family care.
yeah.
He's been there a month.
Oh.
I guess I can't talk. It's alright.
Alright, maybe you can talk to her after.
Right, yeah.
I thank you for all this, almost too much information, it makes you really think of where you are and whatever, but I thank you so much for coming.
welcome.
And, if anyone wants to talk for afterward individually, that's fine.
Right.
And all
Next
this
week-
that they did videotaping, will it be available, Diane?
It'll be on Facebook all the time, just on our website. So
Okay, because last week our.
No, it didn't work, but that's why we have Diane today, so it will be. And next week is on home health and hospice, so different topics. But I
Is
thank
that the
you.
one Chris is doing?
Yeah, Chris is doing, as well as Corey Rice.
Okay. I don't know Corey, but I know Chris.
There are boxes of cookies out there, ladies and gentlemen. So please, if you need a cookie on your way out, or 2 or 3, please take one. And thank you for